My name is Angela Sinachi, and I am a board-certified cardiac vascular registered nurse. I am also the clinical coordinator of the cath lab at OakBend Medical Center, Richmond, Texas. I'm the author of the best-selling heart health book, Working with Heart. And I've been with OakBend for 8 years. And on the personal side, I am married with 4 children, and I'm involved in non-governmental organizations helping the less privileged, abused women, and troubled teenagers. For me, as a registered nurse, I would say the most impactful procedure that comes through the cath lab is the STEMIs. Because when the STEMIs happen, it means that the patient is having an active heart attack, and every single minute of that patient's life counts. So these are the challenges we see mostly in our community, the Fort Bend community we take care of. The challenges of patients who have a stent, a heart attack, and they get a stent, and they have little or no resources to do a follow-up or to keep up with their prescribed meds. And that can be frustrating because after putting in a lot of work, they just can't get it done because they do not have that resources. And on the other hand, we have the other patient that has the resources to get their prescribed medication, but for some reason, they just don't follow through with the doctor's orders, with the discharge instructions, and they refuse to take their meds. So it behoves on us as a community, as the family members, to let them know how important to be on the dual antiplatelet therapy that will help them not to have a second heart attack, because not taking the prescribed medication is setting themselves up for a next heart attack that they might not survive. Of recent, we've been getting younger patients come to the cath lab. In the past, the patients used to be in their late 40s, but of recent, we see patients in their 20s come to the cath lab, and you expect them to have clean coronaries, but no, they are actually having a heart attack, and they end up getting stented as early as in their 20s. That is not good. So for me, I believe it's a call for an aggressive campaign to educate the community about the heart health, and part of it is to teach them about their blood pressure control, to teach them about watching their sugar levels, diabetes, and of course, just to be on the safe side, know their numbers. At OakBend Medical Center, we offer the calcium score test. It's a non-invasive procedure that helps you know your heart risk, your cardiac disease risk, and it's something the patients and the community should take advantage of. For patients and families navigating heart challenges, I think prevention is key. So the start of it is knowing your familiar history and the issues that run in the family, because if a family has, if they are predisposed to cardiac events, cardiac issues, is a call to be proactive and take a better care of your heart as a family member. And for those who already are diagnosed with heart diseases, it behoves on them and as a family to help them be compliant with their medication, and also to make sure that they get under the care of a cardiologist. It helps to get them on the right path. My work here at OakBend has broadened my experience and knowledge of the cardiology procedures, and most stories that are in my book are influenced by the patients I've come across at OakBend. And in chapter 5 of my book, I talked about takotsubo, that's the stress-induced cardiomyopathy, that's a broken heart syndrome. We've seen a couple of patients come through the cath lab with that syndrome, and it's their stories, their recovery process. We as the cath lab team, the physicians, the team, we get to be a part of their journey to recovery and get to educate them on how to better handle life issues, because these patients, they come in, when people hear about broken heart syndrome, they think about it literally, but in the cath lab, we see them physically on our tables, and the heart is actually crying. The heart releases the enzymes that we see in heart attack. So it mimics everything that happens in a real heart attack. It's just that the coronaries are clear. So we educate them. Life happens because most of these people, those events happen due to accidents, divorce, death in the family, life not happening the way they wanted it to happen. So it's a good way to educate the patients and tell them that life happens and we need to get our stress level down and handle life better when life does happen. And also in my book, I talked about the peripheral artery disease. Here at OakBend, we do a good deal of taking care of our patients with the peripherals too, because as the heart coronaries are getting clogged up, so are the peripheral arteries, and we also revascularize and help those patients to get to a recovery point and a better life. I'm very excited about the cardiology world because it's ever evolving, and there are recent inventions of the IVOS, the FFRO, and doing very minimally invasive procedures, and that really helps the patients to recover faster. In the past, most of the cardiac procedure was done through the groin, but nowadays we do it through the radial artery, which makes for a quick recovery time for the patient, and they get back to their activities for daily living and get back to life very fast. And something I'm really excited about is the LVAD. That's an acronym for the left ventricular assistive device, because when patients undergo a massive heart attack, what ends up happening is that the result of that massive heart attack is a heart failure, and that makes them a candidate for a heart transplant. And we know that those hearts for transplanting are not readily available. So the LVAD takes the place of a heart transplant. It's a device that is connected to the heart, and it's but the controllers are outside the body, but it helps to pump blood and helps the patient to live a good life. So it's a big step towards a greater good of the people, and I'm really excited about that.